If you asked 10 cardiologists what to eat for your arteries, you would get 10 different answers. Low fat, high fat, no red meat, only plants, Mediterranean, DASH, keto, vegan. I've heard all of them. I've read the research behind all of them. And after 20 years as a cardiovascular surgeon, 20 years of seeing inside human hearts and arteries, here is what I've concluded. Most of the debate is missing the point, because the question isn't which diet is theoretically perfect. The question is which specific foods show up again and again, across study after study, decade after decade, with measurable evidence that they are doing something real inside your arteries. Foods that reduce the inflammation driving plaque formation. Foods that protect the delicate lining of your blood vessels. Foods that help your arteries relax, widen, and stay flexible. Foods that your body after 60 genuinely needs, because after 60, the margin for arterial damage is narrower and the need for protection is greater than it has ever been. That's what this video is about. Not a diet. Not a plan you'll abandon in 6 weeks. Just the highest yield foods, the ones the research keeps coming back to, that you can add to what you already eat, starting today. And at the end, I'll show you 2 non-food strategies that the evidence also supports. One of them surprised even me the first time I looked at the data. Stay with me. My name is Dr. Olivia Kessan. I'm a cardiovascular surgeon, and in 20 years of operating on damaged arteries, what I see most consistently is the slow, silent accumulation of a process that good daily choices can genuinely slow, and in some cases, partially reverse. Let's start with the biology. Because if you understand what's happening inside your arteries, these food choices will make complete sense. Arterial plaque does not form overnight, and it is not simply a matter of eating too much fat, as we were told for decades. Here is what actually happens. Your arteries have a thin inner lining called the endothelium. It is 1 cell thick. Its job is to regulate blood flow, prevent clotting, control inflammation, and keep the arterial wall smooth and flexible. When the endothelium is healthy, blood flows freely. Arteries dilate and contract as needed. Pressure stays stable. When the endothelium is damaged by inflammation, oxidative stress, high blood sugar, or sustained pressure, LDL particles begin slipping through into the arterial wall. Once inside, they become oxidized. Your immune system reads this as an injury and sends white blood cells to the site. Those cells engorge with oxidized LDL and become what scientists call foam cells, the building blocks of arterial plaque. Over years and decades, that process accumulates. Plaque grows, the artery narrows, blood flow decreases, pressure rises to compensate. After 60, 3 things make this process more consequential. Your body produces less nitric oxide, the molecule your arteries use to relax and widen. Your arterial walls are naturally stiffer, leaving less room for error. And oxidative stress accumulates faster than your cell's repair mechanisms can keep up. So the foods that matter most after 60 are the ones that specifically address those 3 vulnerabilities. Foods that protect the endothelium, reduce oxidative stress, and help restore nitric oxide production. Here is what the research shows. The first food surprises most people. Not because it's exotic, because the research behind it is more specific than almost anything else in cardiovascular nutrition. Pomegranate. In a clinical study that ran for 3 years, researchers followed patients with documented carotid artery stenosis, meaning measurable narrowing of the main arteries supplying the brain. One group consumed pomegranate juice daily. The control group did not. In the control group, carotid, intima media thickness, the measurable thickening of the arterial wall that indicates plaque progression, increased by 9% over 1 year. In the pomegranate group, that same measurement decreased by up to 30%. The artery was measurably less narrowed after 1 year of daily pomegranate consumption. Not less bad, better. Here is the mechanism. Pomegranate is extraordinarily rich in polyphenols, antioxidant compounds that directly target the oxidative stress-driving plaque formation. They inhibit the oxidation of LDL particles inside the arterial wall. Without oxidized LDL, the foam cell cascade, the immune response that builds plaque, doesn't get the trigger it needs. Pomegranate also supports nitric oxide production, helping arteries relax and maintain flexibility. And research from Technion Institute of Technology found that pomegranate reduces arterial oxidative stress by 33% and arterial cholesterol content by 28%. Two of the core mechanisms of plaque accumulation. I'll call her Frances. She was 73, with a history of carotid artery disease and a grandmother's conviction that food could do things medication couldn't fully reach. She added pomegranate seeds to her oatmeal every morning and drank 4 ounces of pomegranate juice daily. Nothing else changed. At her follow-up imaging 18 months later, her radiologist noted something he hadn't expected to write: modest improvement in carotid wall thickness. She brought the report to my office with a quiet smile. I wasn't surprised. The research had been telling me this for years. Practical note: fresh pomegranate seeds and pure pomegranate juice both deliver the benefit. Look for juice with no added sugar. 4 ounces daily is the amount used in the major studies. The second food is the one patients are most delighted to hear about: dark chocolate. And I want to be precise here, because this is where the research is specific and the product matters enormously. A meta-analysis of 19 randomized controlled trials found that dark chocolate and high flavanol cocoa significantly improved endothelial function, the health and responsiveness of that thin inner arterial lining, compared to placebo. The effect size was clinically meaningful, and one study found that the magnitude of benefit from daily high flavanol cocoa was comparable to that seen with statin therapy. Not vaguely comparable. Comparable. Here is the mechanism. Dark chocolate contains flavanols, specifically epicatechin and procyanidins. These compounds increase nitric oxide production in the endothelium. More nitric oxide means arteries dilate more easily, blood pressure drops, and the arterial wall becomes less sticky, meaning fewer LDL particles adhere and fewer inflammatory cells accumulate. A randomized controlled trial found that daily dark chocolate consumption measurably reduced arterial stiffness. The pulse wave velocity decreased significantly and improved flow-mediated dilation, a direct measure of how well arteries open in response to blood flow. But here is the critical distinction that most coverage of this research misses. The benefit comes from flavanols, and flavanols are destroyed by processing. Milk chocolate has almost none. Over-processed dark chocolate has little. The research consistently uses dark chocolate with 70% cocoa content or higher. 10 grams of high-quality dark chocolate, that's roughly 1 or 2 small squares, is the amount used in the 1-month trial that showed significant arterial improvement. This is not permission to eat a candy bar. It is evidence that a small, specific, daily habit can have measurable arterial benefits. I'll call him Thomas. He was 67, a former engineer with a precise mind and a skeptical relationship with nutrition advice. He had heard too many things proven and then reversed. But when I showed him the trial data, the actual pulse wave velocity numbers, the flow-mediated dilation measurements, he became the most disciplined dark chocolate consumer I have ever counseled. 2 squares of 85% cocoa chocolate after lunch, every single day. At his next vascular assessment, his endothelial function markers had moved in a direction that impressed the technician running the test. "Whatever you're doing," she told him, "keep doing it." He keeps doing it. The third food category is one that operates through a mechanism most people have never heard of, but that becomes one of the most powerful tools available after 60 specifically. Beetroot. And more broadly, nitrate-rich vegetables, spinach, rocket, celery, kale, fennel. Here is what makes this category uniquely relevant after 60. As we age, our bodies produce progressively less nitric oxide through the standard enzymatic pathway. This is a significant contributor to the arterial stiffening and blood pressure elevation. That becomes harder to manage after 60. But there is a second pathway, a dietary pathway. When you consume vegetables rich in inorganic nitrate, those nitrates are absorbed and converted, first in the mouth by oral bacteria, then in the bloodstream, into nitrite, and finally into nitric oxide. This is not a supplement. This is food doing chemistry that your body needs done. A landmark double-blind, randomized, placebo-controlled clinical trial published in the AHA journal Hypertension found that 4 weeks of daily dietary nitrate supplementation, equivalent to roughly a glass of beetroot juice, reduced systolic blood pressure by 7.7 millimeters of mercury in hypertensive patients. That is the magnitude of effect of a first-line blood pressure medication from food. The same trial found measurable improvement in arterial stiffness and endothelial function. The artery was physically more responsive after 4 weeks of daily nitrate. And a University of Exeter study found something particularly important for older adults. The blood pressure lowering effect of nitrate-rich beetroot juice was actually more pronounced in adults in their 60s and 70s than in younger adults, because older adults tend to have more impaired nitric oxide production to begin with, more room for the nitrate pathway to make up the deficit. The practical picture is simple. Beetroot juice, small glass daily, no added sugar. Or rocket salad, spinach, celery, kale, incorporated into regular meals. These are not exotic foods. They are the vegetables that happen to contain the specific compound your aging arteries most need. The fourth food is one I recommend to almost every patient I see in a cardiovascular context. Not because of one dramatic study, but because of the consistency of what the research shows across multiple mechanisms. Walnuts. Walnuts contain alpha-linolenic acid, a plant-based omega-3 fatty acid, along with polyphenols, arginine, and fiber. This combination targets arterial health through several pathways simultaneously. A randomized controlled crossover trial found that daily walnut consumption, 56 grams, roughly a handful, significantly improved endothelial function in overweight adults with visceral adiposity. The mechanism is direct. Walnuts provide the raw material for nitric oxide production through the arginine pathway, while their polyphenols reduce the oxidative stress that destroys nitric oxide before it can work. They also reduce LDL particle number and improve the LDL to HDL ratio, not just the total cholesterol number, but the actual composition of particles moving through your arteries. And the effect on inflammation is measurable. C-reactive protein, a blood marker of vascular inflammation, drops with regular walnut consumption in a way that few other foods replicate. I'll call him Victor. He was 71, with elevated LDL, borderline arterial changes on imaging, and a deep resistance to the idea of adding medication. He agreed to one thing: a handful of walnuts daily for 6 months before we revisited the medication conversation. 6 months later, his LDL particle number had decreased. His endothelial function markers improved. His CRP had dropped. We postponed the medication conversation. It's still postponed. A small handful. Daily. Whole. Not salted, not coated. That's the protocol the research uses, and it's the protocol that produced those numbers. Now, I want to spend a moment on something the benchmark research consistently includes, and that I think is just as important as the foods to add. The foods that are sold as heart-healthy but require careful attention. Fruit juices, including those marketed as natural, cold-pressed, or vitamin-enriched. When fruit is juiced, the fiber is removed. What remains is a concentrated sugar solution that is absorbed rapidly, triggering the insulin response and the fructose-driven blood pressure mechanisms we discussed in the last episode. The antioxidants in the juice do not compensate for that effect. Eat the fruit. Don't drink the juice. Flavored oatmeal, one of the most misleading products in the health food category. Plain oatmeal has genuine cardiovascular benefit, soluble fiber that binds LDL in the gut and reduces its reabsorption. The instant-flavored versions frequently contain 12 to 20 grams of added sugar per packet. The benefit of the oat is largely offset by the sugar load. Buy plain. Add your own fruit. Plant-based snack bars, granola bars, protein bars, and natural snack bars marketed with heart imagery. Many contain as much sugar as a candy bar, packaged in language that implies health. Read the added sugar grams. If it exceeds 5 grams, it belongs in the same category as the candy bar it resembles. The pattern across all of these. The packaging says health, but the ingredient list tells a different story. After 60, your arteries respond to what is in the food, not what is on the box. I promised you 2 non-food strategies. Here they are. The first is exercise, but with a specific emphasis that most general advice misses. A randomized controlled trial published in the European Journal of Preventive Cardiology found that 6 months of supervised high-intensity interval training produced a significant reduction in plaque volume in coronary arteries. The regression was measured on imaging, not inferred, and it was comparable in magnitude to what researchers observe with statin intervention. That is not a trivial finding. HIIT does not mean extreme exercise. It means intervals of elevated effort alternated with recovery, something as simple as walking fast for 2 minutes, then slowing for 2, repeated for 20 to 30 minutes. The key is that the cardiovascular system is challenged, not just maintained. The second strategy is one I did not expect to be citing in a cardiovascular context when I first encountered the data. Sauna use. There is now a body of observational and mechanistic research linking regular sauna bathing to improved endothelial function, measurable reductions in arterial stiffness, and significantly lower rates of cardiovascular mortality in populations with consistent sauna habits. The mechanism is believed to involve heat-induced nitric oxide release, improved blood flow dynamics, and a passive cardiovascular workout that shares some physiological characteristics with moderate aerobic exercise. The evidence is not from randomized trials. It is observational. So I present it as a promising area, not a proven prescription. But the direction of the data is consistent enough that for patients who have access to a sauna and no contraindications, I consider it a reasonable addition to an overall cardiovascular health strategy, not a replacement for exercise, an addition to it. Let me give you what I want you to actually walk away with, not a new diet, a set of additions. 4 ounces of pomegranate juice daily, or fresh pomegranate seeds added to what you already eat. No added sugar in the juice. 1 to 2 squares of dark chocolate daily. 70% cocoa or higher. This is not a large quantity. It is a specific one. A small glass of beetroot juice daily, or consistent incorporation of nitrate-rich vegetables, rocket, spinach, celery, kale, into your regular meals. A small handful of walnuts daily, whole, unsalted. And when you look at packaged foods, read the added sugar grams before the sodium grams. That number is telling you something about your arteries that the front of the package is not. None of this requires a diet overhaul. None of it is expensive or unusual. What it requires is consistency, the same consistency that plaque formation uses against you, turned around and used in your favor. I want to say something directly before we finish. Arterial plaque is not a verdict. The research on these foods exists precisely because the process of arterial damage is not one way. The endothelium responds to what you feed it. Inflammation can be reduced. Nitric oxide production can be supported. The progression of plaque can be slowed, and in some patients, partially reversed. I have seen what hardened, calcified, inflamed arteries look like from the inside. I have also seen what the research says is possible when the right inputs are consistently applied. There is a gap between those two outcomes. These foods live in that gap. Please share this video with someone in your life who is thinking about their heart health. Someone who has been told to eat healthy without being told specifically what that means for their arteries. Subscribe to this channel. Every week, I bring you research-based health information for adults over 55. Clearly explained, nothing to sell you. And leave a comment below. Which of these 4 foods surprised you most? And which one are you going to try first? I read everyone. Take care of that heart. I'm Dr. Olivia Kessan.